Good morning, good afternoon, and welcome everyone to today's webinar, The Reflection Room, Creating a Space to Pause, Reflect, and Share with Dr. Celina Carter. I'm Andrew Andresco with Transforming Chaplaincy, and we are delighted you could all join us. Some housekeeping instructions off the top. You are listening in using your computer speaker system by default and are muted. Should you have any technical questions regarding your audio or visual, please type those into the chat box located in the platform's dashboard. You will have the opportunity to submit text questions for our presenter by typing your questions into the questions box of that same control panel. You may send in your questions at any time during the presentation. We will collect these and hope to include them during a brief Q&A session at the end of today's presentation. Dr. Carter has provided the PowerPoint in the form of a PDF that is attached to the control panel. You can download that. I wanted to bring your attention to some webinars we've got coming up on February 7th at 1 p.m. Eastern with Rachel Daly, Chaplaincy and Mental Health, Empowering Chaplains for Integration. This is the third part of a three-part series we began during Spiritual Care Week. And on Wednesday, February 28th, research and practical tips for palliative care clinicians attending to the existential experience. You can register and find more information about these webinars at our website. I will also post the registration links into the chat once Dr. Carter has begun her presentation. With that, I'd like to introduce Sarah McAvoy to introduce our guest.
Thank you so much, Andrew. We couldn't host these webinars without your help and support, and it is greatly appreciated. As Andrew mentioned, my name is Sarah McAvoy, and I'm one of the co-conveners of the Elder Care Research Network for Transforming Chaplaincy. With me today is my colleague and co-convener, Catherine Lines. Catherine will introduce herself a little bit later in the Q&A session. Catherine and I saw this presentation at the 10th International Conference on Spirituality and Aging over the summer in Ontario, and we're so tickled to be able to bring it to you. And we're thankful for Celina for making that happen. Celina Carter is a nurse and research scientist at the SE Research Centre in Toronto, Ontario, Canada. She also sits on the executive committee of the Palliative Care Nurses Interest Group and is with the Registered Nurses Association of Ontario and is an instructor in the Mindfulness Informed End-of-Life Care certificate at the University of Toronto. Celina holds a BSN from Dalhousie University, an MN from the Toronto Metropolitan University, and a PhD from the Lana School of Public Health at the University of Toronto. Her dissertation focused on improving primary care for frail older adults by examining the way policy, language, and norms shape clinician-patient communication and decision-making about the end-of-life care. At the SE Research Centre, Celina leads the Reflection Room Grief and Bereavement Project, connecting best practices in spiritual care and grief support for older adults living in long-term care. Welcome, Celina. We're so happy to have you.
Thank you. It's a pleasure to be here today. Thank you for such a nice, thorough introduction. So I'll be speaking to you about the Reflection Room. And I wanted to start by saying I'm calling in from Toronto, Canada. And I'm part of the SE Research Centre, as was mentioned, which is part of the larger organization called St. Elizabeth Healthcare. And this is a center of excellence in the learning health system, and one of Canada's largest not-for-profit social enterprises, with operations dedicated to transforming change across the continuum of care. And the Research Center specifically conducts impact-oriented research with experts by experience to improve the lives of Canadians. And we developed evidence-based solutions to tough health and social care problems. And one of our areas of focus, which I'm quite involved in, is dying, death, and grief, which is the area where the reflection room sits in our research portfolio. So on the screen here, there are some pictures of the reflection room project. And overall, it's an arts-based, unfacilitated storytelling intervention that invites visitors to pause, reflect, and share. It's been implemented or installed in many different settings, from community settings like libraries and art galleries to more healthcare focused settings, hospitals, hospices, and things like that. And it's invited all visitors, so all types of visitors that would enter these spaces can engage, which is fairly unique. So we have, leaders, patients or clients, staff, all entering the same reflection room or being invited to do so. The reflection room started off as a participatory research study in 2016, and the research component ended in this year, but it's an ongoing project that's now been taken over by the St. Elizabeth Foundation to continue scaling and spreading the intervention. And most recently, May of last year, it was offered to all hospices in Canada as an intervention that they might like to offer their communities. So looking at these pictures, these three pictures, you start to get a sense of perhaps what the reflection room is about. You might notice the chairs that invite people to sit and reflect. There in the pictures, you can see a red ribbon wall or reflection wall and some cards, which is where people can display stories. They can share their stories there, and you can also read the stories of others. You might notice some dim lighting, some flowers. And so you're starting to get the sense of the components of what makes up a reflection room. And we've found that when people visit these rooms over the ways that we've evaluated it, that people after visiting, tend to be more comfortable thinking and talking about dying, death, and grief. Some become more likely to plan for their end of life. And something about visiting these rooms offers something that's supportive to those who are grieving. You can see these three pictures are also related to the three versions or phases of our reflection room project. So in the beginning, the first two pictures are related to the reflection room that was really about increasing people's comfort, talking and thinking about dying and death. And the last picture on the bottom right was the last version of the reflection room, which was really about attending to pandemic-related grief in long-term care homes in Ontario. So while the components of the reflection room stayed the same, the intention or the invitation evolved over time. So I'm going to first tell you about the three ideas or principles that provide the foundation for how the reflection room was designed. We are then going to experiment with going into a virtual reflection room. And I'll explain more about that in a moment. We'll take about 5 to 8 minutes there. And then we'll come back and I'll share some key findings about the last phase of the reflection room when it was implemented in long-term care homes. So the first idea or framework that will likely resonate with this audience are the organizational best practice principles for providing end-of-life care. And so on the screen are the 4 principles that influence the reflection room. The first one was allowing spiritual questions and issues to emerge. And this was influenced the design of the reflection room about the importance of having space for people to be able to pause, to allow these questions to emerge. The second principle is about allowing acts of witnessing. And this can be about perceiving another person's questions, struggles, joys, etc., and also feeling seen in your own experiences of that. And this was really supported in the reflection room through the sharing of stories. The third is cultivating sacred spaces, which is about being attentive to the qualities or the aesthetics of a place that make it feel special. So this is about, the reflection room is about having a dedicated space for this reflective storytelling practice. And the last principle is about dedicated time to marking transitions and processing experiences. And this is about prescribed embodied acts that promote transformation. And in the reflection room, this is done through the reading and physically writing reflections or stories. The next principle is, or idea that informs the reflection room, is participatory unfacilitated community art. So a lot of supports to that aim to increase people's comfort with dying and death or support them in their grieving are structured interventions. And one thing that we were inspired by is this artist, Candy Chan, who does installations, and you can see two examples of these on the screen. And it's really about inviting people to engage in a way that is unfacilitated, so open to their interpretation or what they need to do in that time. And also that they get to choose when and how they engage, rather than you have to come at 1 on a Monday. Knowing that the reflection room is there and open allows them to peek their head in, maybe go back, maybe come in for another time, maybe revisit. So there's lots of flexibility in terms of when and how people engage with the room. The last framework that guides the reflection room is the power of sharing stories. So Schleckner and colleagues developed this model of storytelling, and it was originally developed for bereaved families in the ICU. And what they said was that a storytelling intervention offers people a way of disclosing emotions, cognitively processing the experience, developing social connections, and through these three things that occur, there's an improvement in the well-being of the bereaved. And so although this is a little bit different in the reflection room, it gave us an understanding of why storytelling might be so impactful to visitors who come to the reflection room. So by combining these three ideas, these spiritual care principles with unfacilitated participatory art and storytelling, we thought that there might be something that offers to soothe the social complexities that can be a barrier to opening up dialogues about dying, death, and grief. And we also wondered if doing this and offering the reflection room, we might be able to support the well-being of visitors who are struggling with these things. So I'm now going to shift gears. Now that you know a little bit about the reflection room, the components that are trying to be present in the reflection room, I'm going to bring us into a virtual room. This is an experiment, so bear with me. So I'm going to stop sharing here and share another screen. Andrew, interrupt me if for some reason I'm not sharing the virtual room.
I shall.
Oh, okay, I'm going to continue thinking that I am doing this. Great. So in the chat, Andrew has shared the link to the screen, and you can go into your own monitor and enter this room together. And the idea here is to give you a little taste of what it might be like to enter a reflection room. Of course, it feels quite different in real life, but it gives us an idea. So you'll see here, there's a red ribbon wall, which you saw in the pictures, and there's some cards that invite you to share stories or read the stories of others. Some of these stories were shared when I presented this work previously with palliative care nurses, which sort of increases some dialogue across settings and across providers. The invitation is to pause, reflect, and share. We invite you specifically to share your experiences with grief. We know that providers, although we often provide a lot of support to people, there isn't always a space for us to attend to our own grief of what emerges for us as we provide the care that we do. So please take this invitation as really, again, what I said, this is an unfacilitated space. So you can sit and reflect quietly. Perhaps you prefer pen and paper on wherever you are. Maybe you want to gaze out the window. Maybe you want to read reflections. I'm going to play some quiet music for 5 minutes, and I'll leave this up on the screen so you can sort of see visitors moving about, which is nice to see that people are entering this space with you. And we'll return back in 5.
So I'll give you a moment to finish up if you are finishing any reflections or ideas. Returning to that model, if there's any emotions that need to get out, any thoughts that need to be processed. We'll take a few more moments here. And this link will be available, I think, for another week. So if this is something you'd like to return to and do at a later date, or have more of an option or an opportunity to read other reflections, please keep that link and revisit if you wish. So I'm going to stop sharing again and come back to this. Again, Andrew, please let me know if I'm not on my cards.
You're good. You're
okay, good. Keep going. Thank you for my PowerPoint. So thank you for going along with that exploration experiment with me. I could see lots of little visitors moving around the screen, which was really lovely. It felt, despite us being virtual and spread across probably North America, very nice to feel some togetherness. And I welcome invitations like when we get to the question period of how that felt for you and what you might change or what really worked or what was challenging. So now I'm going to shift gears a little bit and talk to you about some findings of our evaluation of the reflection room in the time of COVID-19. I don't need to tell you all about the challenges of what happened in long-term care homes. I'm sure we're all very familiar. But what we did was implement the reflection room in long-term care homes in Ontario, specifically to look at or attend to pandemic-related losses, which of course was beyond just death and illness, but a lot of social and psychological and emotional losses as well. So what happened was that the community that was responsible for attending to the pandemic response for long-term care homes were hearing from long-term care homes, and they really felt that they needed support for people's mental health and grief that was coming up from the pandemic. And they were requesting that there was a way for people needed an opportunity to be able to reflect on the experiences of isolation and trauma. They needed to share their emotions and thoughts about all the things that had happened to them through the pandemic. And there was a request from communities. They felt like there needed to be new rituals around grieving a death. And this might have been coming from the way that a lot of funerals or the ways that sort of celebrations of life were carried out were disrupted during the pandemic. And so our team was approached to see if we could adapt the reflection room for this purpose. And we said, yes, let's try. So there were 32 homes in Ontario that installed a reflection room. And then there were 19 others who asked for a reflection room kit, which I'll explain in a moment. But over the course of, I guess, a year and a half, was maybe a year, maybe 2 years, that we did this, 19 homes were unable to find either the space or the staff to set up the reflection room. So they still have the kits. They may have set it up by now, but the research ended. But this was due to staffing challenges and also ongoing outbreaks that disrupted, that really altered the way that space was used in the home. So what we collected for data was reflection cards. So these are the cards that were put up on reflection walls. We just asked for scanned copies of them because the cards sort of became artifacts of the communities that created them. We also offered surveys. So in the reflection room, there'd be a paper survey that visitors could fill out if they wished. It was not mandatory at all. So we had 75 surveys from staff, residents, and caregivers. And I should say the reflection room was for the whole community. So it wasn't an intervention just for staff or just for residents or just for caregivers. It was meant for the whole community to visit, which I'll get to, but isn't interesting. There's not always a lot of cross dialogue between different groups and communities. We had 23 surveys from long-term care home representatives. So these are the people who reached out and agreed to set up and maintain the reflection room while it was in their home. And then we did 16 interviews with these same individuals. Now, I don't know if this was totally explained, but in the beginning, the reflection room was often a relatively big reflection room. So it's an installation that might take up a whole conference room or a whole section of a library. So it was quite large. And when we were adapting it to long-term care homes, the community said, that's just not possible. We don't have the space. Every long-term care home is so different. We need to distill the reflection room down into the most basic components and then make it very adaptable so that each home can make it its own, install it in whatever space works for them, but also add in elements that are connected to the culture of their home. So here's a list of the components that went into what we called a kit. a simplified kit. And so there's the reflection wall, which is really important. Again, going back to these principles for witnessing, blank reflection cards for processing and reflecting. We asked them to put it into, we suggested they put it into a quiet environment where people knew where it was and would be reminded it was there, but not somewhere like really busy in a busy hub. We invited, we asked them to provide seating so people could pause and reflect. And then you can see some framed reflection cards, which give people, it's an invitation of what might stimulate some processing for them, what others might be feeling and thinking, some tea lights, some artificial flowers, and then homes could improvise. So some people had large couches or different lighting or music, and they made it their own. So I'm going to share some of the stories that were on the reflection cards. And if you're familiar with the dual processing model of grief, we used that as a framework to understand what people were experiencing through the pandemic related to their grief. I should say there were maybe a quarter of the cards that we analyzed also were about grief in general. So, my mom died and I'm sad, sort of thing, like not related specifically to the pandemic. So I'm just reporting on cards and themes that were related to the pandemic that helped us understand the grief that people were feeling. So there's 5 themes and I'll share them now. So the first one here that you see is overload. And this is really about people feeling like they have more, they're bearing more than they can cope with. Some of this was from staff, so particularly the burnout was from staff, and also the often being fearful of COVID, particularly sharing it with colleagues or other residents or taking it home to family members. But many people also shared that they were just overwhelmed. And then also some distress. So I'll just give you a moment to read these reflections. The next type of reflections that we saw were loss-oriented stressors. And related to the losses people were grieving. So this was death, meaningful activities, and struggling with loneliness or isolation. And these were the main loss-oriented stressors related to the pandemic that were present in the stories that were shared. The next one is restoration-oriented stressors, or sharing stressors about either avoiding the loss or attending to what else needs to be done as life moves on. So the 2 types of reflections in this area were returning to normal. What is it going to be like? What's going to happen? How do we do this? How do we return to normal? And in that, very much connected, is how do we adapt to this new world? The next 2 are not part of our understanding of the dual processing model. So these 2 were a little bit unexpected for us, but then if you go into the literature, they start to make sense. So this one is about learning through loss. So while people had a lot of stressors related to the pandemic, there were a lot of lessons about the importance of time together. Particularly staff just reflected on how important their role was for caring for residents. The perseverance of people and communities, so how people persevere through this hard time with being really adaptive and loving and collaborative, and also giving people a real sense of distilling down what's really important in their lives. The last one is gratitude through loss, and I think this connects to the learnings, but people expressed a lot of gratitude for the staff, so whether it was a caregiver, a resident, or actually staff thanking each other, lots and lots of gratitude for those who provide care during this hard time. Residents and caregivers really similarly expressed their thankfulness for receiving good care. People talked about that despite these isolations and loneliness, there were actually stronger connections. There felt like more of a togetherness. And then people expressed a lot of gratitude for being kept safe from the pandemic, from COVID-19. So we wanted to know if the long-term care reps and people who visited the room felt that if this room supported those who were grieving, and in what ways. So there were the vast majority of long-term care home reps who said that yes, the reflection room is helpful for coping with grief. The people who said no, it was much more about there was a lack of visitors to the room, not the room itself, but they felt how it had been implemented in their home didn't have an impact, but it was related to if people knew about it and that it wasn't used. So why people thought it was effective for grieving, for people who are grieving, is it offers a quiet, restful place, provides an outlet for thoughts and emotions. Staff in particularly a few times said that it evoked conversations about grief. So just introducing the idea that there was a reflection room stimulated new conversations. Visiting the room allows people to reflect and process. And then the staff also just talked about sort of increasing the scaffolding of support. So the reflection room was one additional support that could maybe meet the needs of people, or that's just that they felt more supported. We asked a similar question on the survey to staff, residents, and caregivers, but we framed it as, would you recommend it? And the vast majority of them said they would recommend. The ones who said that they wouldn't, there were two caregivers. One said that they felt a chapel was a reflection room. So for them, there was maybe it wasn't needed because they get a lot of support through a religious community or setting. And then one caregiver had some concerns that opening up these questions in an unfacilitated way could actually harm people, because it might evoke or elicit some big feelings that might be unsupported. And if anyone, I can sort of speak to how those are attended to if anyone has questions about that. So you can see that the why staff, residents, and caregivers would recommend the reflection room is very connected to why the staff feel that it supports grieving. The two things that were added or additional from the perspectives of other staff, residents, and caregivers is that it supports community building and connection, and this is really through I think that cross dialogue of sharing stories with the whole community involved. And then a few people wrote it's good for the soul. It was more than one person. And there's something that visiting the room and going to the room, there's something that is soothing to the soul about it. So suggestions as we sort of, the talk is coming to a close, but some things that the long-term care home representatives talked about in their interviews for suggestions for success might be of interest to your community, particularly if you're thinking that you might want to do something like this. So one thing that they recommended was choosing a meaningful topic. So some long-term care homes implemented the reflection room as the pandemic, I think it was getting into maybe its 8th wave here, and it didn't feel as the invitation to reflect on the pandemic didn't feel as like the most important question for that community at the time. So when inviting a topic of reflection, thinking about what's a current and important invitation. Someone else talked about just, again, being sensitive to what question you ask so that it's not re-traumatizing. Is it important to go into those feelings? I would suggest it is, but how do we do this in a way that feels supportive? Prioritizing accessibility. This is really important when selecting a location, but also thinking about can we expand what we're asking for? So maybe it's not just written reflections, but there's, as an individual, some people ended up doing it in buddies, particularly if it was challenging to write or read. So can you have someone read them for you, write for you? And can we maybe expand into drawings as a mode of reflection? And the accessibility piece, one home made a reflection room cart. So for those who weren't physically able to make it to the room, they brought a reflection room cart and sort of tried to transform the resident's room into a reflection room for a time, which I thought was a beautiful offering. So participation across the organization, that one home that talked about how they didn't find the room effective because no one went. So how do we communicate the purpose of the room to invite participation, but again in an unfacilitated, open invitation way? And they really encourage this importance of the whole community participating. So it's not just for residents, not just for one type of person in the community, but for everyone. And then a good suggestion, some homes got residents or other staff to participate in the designing of their room. And this really, there was something there that was supportive of community building when they did this. And also buy-in from the community of like, we've created this room together for us, for our needs. Location, really important that there's this balance of it's in a space that's easy to get to, but it's also quiet and private. And finding that right balance was hard for some of the long-term care homes. And then design. So people really talked about, they had this kit to work with that was great, but they also often wanted to bring in calm colors. They wanted to figure out ways to really prioritize rest, the importance of the aesthetic of the room, putting art in it, fresh flowers, inviting images of nature, which had been in our original reflection room, but when we distilled it down into the smaller kits, it became just the components. We had the artificial flowers, but it became into the essential components. And then some, in terms of rest, being flexible about how people use the room. So it's like for rest, for prayer, for music, for contemplation, really opening up this idea that people grieve in all different ways, and those ways need to be welcome. So that sort of concludes most of what I wanted to share with you today. But it's this idea of how do we support grief, and that having these unstructured storytelling, arts-based initiatives seem to offer something useful for communities experiencing loss. There's something really important about this community sharing and receiving stories that supports connectedness, feeling less alone, that cultivates something that supports people to feel some well-being from visiting the room. And there's this also, particularly for staff, but for all of us, this moment of pausing and feeling rest so that we can ask those important questions. So if you want to get in, our St. Elizabeth Foundation is running the reflection room now. So there's an email there if you ever want to get in touch and ask questions about what they're doing or where they're at in terms of being able to acquire a kit. Their contact information is there. And the SE Research Center, where I'm a research scientist, we have a community list that shares opportunities to participate in action-oriented research projects. So if you want to join our community list and hear about some of the projects that we're recruiting for, you can scan the QR code. And yeah, I welcome any questions that anyone has. There's some references, and these are on the slides or in the PDF if you want to return to them at another time.
Thank you so much, Celina, for your presentation. It was just so moving to me, and the effectiveness of even the virtual reflection room, the comments were just so moving and touching. And it speaks to me how a space like that shows how I've talked so much with my students about how a lot of the trauma we experienced during the pandemic has not been addressed intentionally, and what does that do to us, and get us thinking about that. And even the virtual reflection room helped just speak to that need that we have to find creative spaces for being intentional with our grief. So I very much want to thank you for that and for your presentation. I got so much out of it. I can't wait to share this. I'm actually teaching a class this term on grief and loss.
Oh, great.
I cannot wait to share this with them. I'd like to invite any of the attendees to post their questions in the question box, not the chat box, but the question box that Andrew had told us about, and try to monitor that. But I did want to follow up on your comment about whether the unsolicited space could elicit unsupported needs, and what your thoughts were on that. And the way that had originally hit me was that, did any of the cards identify any kind of red flags? For example, maybe somebody going through a mental health crisis, how do we find them and connect them to resources? Has there been thought along those lines?
Yeah. None of the cards that we analyzed raised red flags. We only had one once early on. It wasn't a red, it was more inappropriate language that we ended up taking down. That was the only card we've ever sort of taken. It was a challenge for us. But I think what happens is this is installed, particularly in this last version, it's installed by a staff member within the long-term care home who is maintaining the room. So they are aware of the cards going up, and it's usually also embedded with often the people who are implementing it, with the social workers or the rec therapists or the chaplains. And so I think that speaking to that, it was already aligned with existing resources that existed in the home. One version ended up putting a sign in the room that if you were struggling and needed more support, to reach out to this person. So as an additional sort of invitation. But anyone, yeah, we didn't hear, this was a concern that was raised by a caregiver, but in any of the sort of surveys or any sort of sense of the person implementing the room or visit, not everyone, of course, filled out a survey, but it seemed to be much more of a supportive place for difficult emotions to emerge, less than feeling actually held in community, less than eliciting something that was overwhelming that they couldn't bear. Yeah, but it's a great thing to be aware of course, to see if, to just have this on the radar if you are doing these things. How do we attend to people who might need additional support, and how do we find them?
That's helpful. Thank you. And a related question is actually whether you do any trigger warnings. At least in my academic context, we are expected to provide trigger warnings if content is deemed sensitive. And that's difficult to navigate because what's sensitive to one person is not sensitive to another. And so we can't meet everybody's needs in providing trigger warnings. But is that something anyone's thought about, is providing a trigger warning?
We do delineate the reflection room space with like a plaque about what it's about. So one thing that came up in our early design was people really need to know when they've entered the room and that they've entered by choice. And then so they know what it's about, they know why they're there. Well, actually they might just be drawn and it might be uncertain, but they've chosen to enter. And then there's the unfacilitated nature of choice throughout. There's no prescription to what you have to do when you're in that space. So I think it gives people a lot of agency and autonomy. But yes, I think the marking of knowing that when you've entered the reflection room is important. Yeah. And I should mention, people also really wanted to know what the bigger picture was. Why was this here? So we ended up creating more of an information sheet about the project of what the whole point of this was, because there was some confusion of, particularly we tried early on an outdoor reflection room, and that was really hard because it was challenging to delineate the space. And then I think some people sort of were in it but didn't know they didn't come into it. So that was a challenge. Yeah.
Yeah, just one more comment then before I pass this over to Sarah to see if she has any questions. That wondering if sometimes when we give trigger warnings, there might even be the possibility that we prevent someone from entering or sharing or reflecting when it could be a useful resource for them. So it gets really interesting how to navigate, but it makes sense to me by establishing the purpose, the bigger picture, giving people their autonomy and agency and letting them know that this is their choice, that creates an inviting space and people can self-select.
Yeah. Yeah, and you never know how maybe at first you don't want to go, and then maybe it stays with you and you think, I just keep thinking that maybe I want to go see it, or this opportunity to change your mind and be curious. Yeah.
Yeah, thank you.
Celina, did it provide things for more artistic expression, like maybe markers or other things that would draw out drawings or sketches?
Yeah, so we didn't, but that was part of the suggestion from the long-term care home representatives, that there could be an expansion of what it meant to share. And I would say there were doodles on the reflection cards that are hard to share in like capture and share, but lots of hearts, some some little doodles. But yeah, I think it's of interest to me because part of the sharing the stories is important, but there's also this the principle about an embodied practice that transforms something, which could, I think there's a lot of richness in drawing and art and how that communicates feelings, how that helps you process your own feelings. So certainly we haven't done that, but I think it's an interesting invitation and adaptation.
One of the other questions I had is, it's been almost a year now since those 32 centers participated. What have you heard back from them? Is this something they continue to do? Just changing the actual invitation?
We have not had too much connection with the homes. I know some were going to keep them up permanently. It felt like a really important space for their community that was, you know, I think it's just so rare to have a place where we gather. Actually, I'd be curious as chaplains if you agree, because maybe there's like multi-faith room offers this, but a place where we gather to pause but feel connected at the same time. I'm curious about your response to that, but it seems to have filled a need in some homes in particular, and they've decided to keep it up. And sort of, yeah, some homes I know added like a gratitude invitation as well. That's the only example that's coming to mind.
I know when we first talked about this and talked about different invitations for the room, you know, to pause and reflect upon, this story comes into my head a lot as a nursing home administrator, just how often a lot of the staff don't have the opportunity to pause and reflect. And I think, you know, a patient that someone has known for a very long time dies, and someone is in that bed the very next day. Yeah. And you know, the opportunity to, yeah, it's such a valuable opportunity to speak about their feelings around that. So I love this concept, you can tell. And I appreciate also the very practical nature of it. It's evidence-based, but it's something that's doable. It's not labor intensive, it's not expensive, it's very approachable, or seems to me, in the long-term care setting. So.
Absolutely. Yeah, that was one of the things we asked the representatives in particular. We tried to design the kit to be really low resource, very feasible. So ideally you can put it up in an hour, maybe 1 hour maintenance, just to make sure there's blank reflection cards and pens and paper or what have you, that the room is still intact in some nice aesthetic way. And they really agree. They're like, this really is something that's very doable, even for a very overburdened workforce, particularly during the pandemic. So yeah, that was something that we landed, it seemed like, through this design of the simplification of the kit. It became really doable for people. And then of course, some homes that had more resources or maybe had a student with them, they really like put in a lot of effort. They repainted walls, they got art, they got plants. So it was this sort of, it could really match the culture of the space that wanted to implement it, and match the resources that were available in the different spaces. Yeah.
Kathy, do you want to close us out? I see we're at our time.
Yeah, I actually do have another question, but I see it's 2 o'clock, so I'll hold off. And I just, again, want to thank you so much for sharing this creative option with us and get us thinking about an adaptable, flexible space that can meet a variety of needs depending how we tailor it. I'm really excited by this opportunity to learn more about it and appreciate the time you put into sharing this with us.
My pleasure. Thank you so much for having me.
Thank you.
Take care.
Care.
Bye.